autoimmunity in women is such a huge thing because it's not just the endocrine system and it's not just the immune system being dysregulated. It's the lifestyle component is massive because of chronic stress in them. And women that live in a suppressive environment and repressive environment, they have highest incidence of this. And if you live in a place where you are not allowed to have a voice, not allowed to express yourself, your ability to communicate being pressed back into you, those are the people you see. And I've read so many interesting studies on this, but I mean, there's this one author, she once wrote, it's like rage turned in on yourself. So many women culturally are trained not to express their feelings or that their feelings are not welcome. And they're trained to repress those parts of themselves. And that compression of these emotions back in your body, it will lash out. You know, we can't, that old saying, what you resist will persist. And so in autoimmunity with women, there's a huge cultural component too. And it's hard to deal with that one because they'll come into practice and they're this, you know, what do you tell them? What do you tell them? This is your home. This is what you grew up with. This is, you know, how do you be the person to break that news to them? And it's not generally accepted by general medical practice that women have higher autoimmunity because of that specific cause. But yet when you see them leaving that environment, you see them leaving from that space when they're no longer in that repressive place, whenever they're no longer, you know, being suppressed, when they find their voice, you see improvement in symptoms. I have patients who just inspire me so much. I can think of one off the top of my head, and she was in a very repressive childhood, repressive young adulthood. And she had a breakdown and she changed her life. She traveled and she changed, and her whole health shifted based upon that. But not anyone can break like that and go travel the world or break away from that place that raised them to be so suppressed. It's hard treating autoimmunity because you want to stabilize them, but you don't want to just stabilize them. If you really want to be a good doctor, you want to stabilize them, you want to find a cure. And, you know, what do you tell them? You know, you're in a marriage where your husband is hurting you and you don't speak to it out of fear and terror. How do you tell them to this is something that needs to be addressed? And, you know, how do you communicate that with them? And do you communicate with them? That's always a challenge we have as physicians. How do you and when do you? It's not easy. That's the hard thing. That's the part of autoimmunity that gets me the most. Is like you can see them in this home or in this workplace or in this culture where they are not ever going to be able to thrive. And you could see their immune system turned upon itself. And when you're seeing that woman who's in that place, in the back of your head, you're remembering the other woman who was in that space who broke free from it and what she turned into on the other side and how beautiful that was. How do you help that person in front of you be that person you know that you've seen? How do you play a role in that? Being a physician is not just prescribing a medication. Being a physician is much more complex than that. Being a physician is someone who looks at the patient in front of you and says, how can I help you become the best version of you, most complete version of you? That's what you're supposed to do as a physician. Anybody says otherwise, any other doctor says otherwise, is just trying to make an excuse for themselves. Because if you think about it, a doctor's dedication is to your wellness. And your wellness is your mental, emotional, and physical wellness. It's much more complex than here's your antibiotic, here's your steroid, here's your SSRI. You know, it's much more than that. True care is someone who spends in the room and truly cares for you and about you and is dedicated to you in that moment. And when it comes to autoimmunity, that's a tough one. That's why it's really tough.